Can you give your pet COVID-19 and other infectious diseases? Well, I have two vets who's going to share answers from their multi-year joint study. Today I have Ann Kimmerline and Christian Lutenegger, and they're going to talk about this. And the first question I want to ask is of you, Ann. Tell us more about this 5-year study and how it came about.
Yeah, thanks so much. This is a study that's really near and dear to my heart. We started it back in 2021 when we were really quite in the midst of COVID-19. And at the time, we didn't know whether cats and dogs could become infected with the virus, and whether they would get sick from it. And so we started this study in order to try to better understand that. And we ended up testing 1,000 dogs and cats across the entire United States, who had been exposed to COVID-19 in their own household.
Now, what are some of the key findings from this?
There were really three major findings coming out of this study. First of all, and very interestingly, about a third of our pets do become infected with COVID-19 as measured by detection of antibodies in the bloodstream. Secondly, and most importantly, most of our pets do not develop any severe symptoms. So that is a really important aspect because that has been a big anxiety of pet owners. And thirdly, a very important aspect when we look at the zoonotic aspect or reverse zoonotic aspects, we did not find any incidents and evidence that the virus can move from our pets back into pet owners or anybody in the environment of that pet. That was a really important finding.
Dr. Lutenegger, is it unusual for viruses to be transmitted between humans and pets? Is it unusual?
It is unusual, but it does happen once every so often. So we call this again zoonotic diseases or reverse zoonotic events, depending which way it flows. We know of a few viruses which can do that. Importantly, there are some parasites which have become very good in doing that, and we need to be careful about those as well. What's important is your annual wellness check normally should be able to catch those.
Now, Dr. Kimmerline, how will the study help broaden our understanding of the transmission of infectious diseases between humans and their pets?
That's a great question. This study obviously focused on COVID-19, but in doing this study, we really set up a framework of collaboration between veterinary hospitals such as VCA and veterinary diagnostic labs such as Antech, where we can continue to study emerging diseases to really better understand whether they can be spread between people and animals.
Dr. Lutenegger, are there any preventive measures pet owners can take to protect their four-legged family friends?
Very important, yes. There are many steps a pet owner can take. First of all, it's the observation of your pet. Is there any discomfort in your pet, which is easily recognizable by a missed meal or by a long period of rest? Secondly, talk to your veterinarian. Consider that once or twice a year wellness exam. There are many tests which can be run in a very affordable way, which address some of these infectious agents which can flow from animals to people and back, not just the viruses, but parasites and tick-borne infectious diseases. Very importantly, keep up to date on your vaccination schedule. And again, talk to your veterinarian. He's your best friend in these matters.
Dr. Kimmerline, one last question for you. Every morning I have coffee with a friend of mine who brings his dog in to Starbucks. And I love, oh, she's great. She really is. And I always get a chance to pet her and get a little lick from her every then. Should I be worried?
Well, in general, as long as she's up to date on her vaccines and all of her preventative medications, no. There are a few things that I would avoid. I'd avoid specifically like sharing food or letting a dog drink out of your water glass, things like that. But in general, we have really close relationships with our pets, and that's a good thing in general. And certainly one of the things that this study taught us is that although we should always be cautious, we don't need to be overly concerned, and kick our pets out of our beds and or things like that.
No, and I enjoy having Ilsa with us every morning having coffee. And I promise you, her owner, his name is Beavis Shock. Don't you dare feed my dog anything. So I'm not worried about that either. Doctors,
That's
thank
very
you.
smart.
Yeah. Doctors, thank you so much for joining us on Morning Blend. And Dr. Ludenegger, one last thing I want to say is I've been watching, you have a lamp behind you that I've seen a lot of, and I keep trying to figure out, do I want to buy that lamp or not? I think I'm going to get it this time. I see it in your living room, so I think I'm going to buy that lamp.
Very good. Thank you, James.
Thank you, both of you. Thank you for joining us on Morning Blend.
Thank you.